I started working on the gun safety issue a dozen years ago. Back then, there were so many gaps in our gun safety infrastructure, gaps in the background check system, gaps in our laws, gaps in our politics. But no doubt, the most glaring was the gaps in data on the issue of gun violence. And that's where the center at Hopkins has made such a difference. Whether you're talking about testifying on Capitol Hill, a meeting with state legislators, or even at a rally, the one thing that is consistent is our reliance on sound data. You can see the signs of the center's impact everywhere. It shows up on protest signs, on politicians' yard signs, and without a doubt, on the signs of the gun safety movement's progress over the past 25 years.
I rely really on the research, some of the policy research they've done that's really influenced the work that I do at the Educational Fund to Stop Gun Violence. Includes the work that they've done on licensing, really opened my mind about what licensing is able to do, not just to stop homicides, but on gun trafficking and preventing suicides.
We've collaborated in a number of different ways. Most significantly, in 2013, we relied upon the Center's and Daniel's research to put together the Firearm Safety Act of 2013. In that bill, we had a provision that required handgun purchasers to obtain a license and to give their fingerprints to the police before they could obtain the license. It was based on the research that had been done by the Center, and it was probably the most important piece of that very important gun safety legislation. In addition, we gave the state police additional authority to oversee the operations of gun stores, and that also was based on the Center's research.
Based on your findings, I introduced the Handgun Purchaser Licensing Act to incentivize states to require a permit to purchase handguns. States require drivers to obtain licenses to drive their cars in order to save lives, and your research demonstrates conclusively that requiring a gun owner to obtain permits does the same, saves lives. This bill was crafted with your input and based on your research. We must keep doing everything we can, including a push from the federal government, to get states to put these and other life-saving practices in place.
I knew to have an impact as an advocate, I needed to learn all I could. And as a new volunteer just entering the world of public health advocacy, I did not think anyone would have time for my multitude of questions. I did not expect world-class researchers to make time to guide and mentor and teach a newcomer. And to my surprise, everyone at the center, Professors Daniel Webster, Cass Crofasi, Shannon Frateroli, Jan Vernick, Alex McCourt, just to name a few, all found value in supporting advocates and fellow researchers at all points in their career and journey. And it wasn't just about teaching the importance of academics, but teaching and modeling the importance of working with those most impacted by gun violence, to fully understand the impact of those gun laws and the importance of the community programs on the ground. Seeing the work that those at the center committed to in Baltimore and working with gun violence interruption programs like Safe Streets made me realize that this was not the ivory tower I'd envisioned.
The team at Johns Hopkins Center for Gun Policy and Research are not resting. These researchers are on the front line, helping implement and devise ways to reduce violence. We can turn to so many examples in our organization's past, working with Dr. Daniel Webster to pass handgun purchaser licensing in 2013, working with Dr. Shannon Frateroli to pass the Extreme Risk Protective Order, working with Dr. Cass Crofasi on the Maryland Firearms Safe Storage Map, child access prevention legislation, and suicide prevention measures. Each of these researchers takes reimagining public safety from a slogan and turns it into a reality.
Right now, our agency is considering a number of interventions to address the rise in shootings and homicides that have occurred during the pandemic. The research led by Daniel Webster and Cassandra Crofasi around proactive investigative gun units is directly informing those policy decisions. Their last report, Reducing Violence and Building Trust, reframes their research in policing and gun violence through the lens of social justice, inclusion, and community engagement. The report is essential to any agency that seeks to rebuild a relationship with their community and address rising gun violence collaboratively and effectively.
As we look to begin the implementation of the group violence reduction strategy here in Baltimore, I know that the center will be working collaboratively as a partner with the city and our department. From my first day as commissioner here in Baltimore, Dr. Webster and his team have made themselves and their research available to me with the goal of working together, hand in hand, in this fight against violence. From police reform to implementing new policies and training under the consent decree, and most importantly, building trust, the Johns Hopkins Center for Gun Policy and Research has been instrumental in working alongside this department in providing recommendations for proactive enforcement.
One of the things I learned about data over the years is how it actually does tell a story. And one of the important things is being able to extract the data and put it in the story form. Like, how does it actually inform the work? How does it, what answers is it giving us? What questions is it raising? So I think that the center has been a vital part in that, because for years they have been evaluating programs and specifically around community gun violence. And that is the problem that's plaguing Baltimore the most right now.